exactly. And my name is Dr. Charles Zahidi. David, tell me a little bit why you decided to replace your missing tooth with an implant, and how did the whole process go? Other patients are going to watch this movie, and how was the whole experience so far?
Well, first of all, the whole experience was a lot easier than I expected, okay? So I used to date a girl who was an assistant in research, and I scared a dentist. But I've had various devices put on my tooth so I could have a tooth that looked normal. I had this space next to my front teeth and it looked bad, so embarrassing. And I didn't want to spend the money on more, and other dentists wanted to grind away adjacent teeth and put something on there, but that was more crap, more stuff to brush away. You can't brush it into eroding teeth. And nothing seemed to work, and temporary stuff, I was afraid I'm going to swallow them. So I've been going without, and no sex appeal, no girls, no nothing. Got a missing tooth. This guy's nuts, okay? Well, I had to do something about it. But the technology for this tooth implant has been getting better and better and better, and cheaper and cheaper and cheaper and cheaper. And then I ran across this fellow. I was changing the locks for him, and he's pretty good. This guy, he says he's pretty good. So he'll do it, and he gave me a decent price. And he did it in a half hour. He extracted an awful tooth that was impacted under the gum. Mm-hmm. You didn't. I thought it was absorbed, but it wasn't. It was still in there. Mm-hmm. He got it out, and it wasn't crudely either. He got it out very carefully. Okay, this is what impressed me. He got it out, and he treated the infection, and still treating the infection, which. Infection in the bone can possibly penetrate the whole body.
Yeah, that's what I told you.
It can cause blood vascular problems and all kinds of problems, possibly even plaques. Yes. We don't know for sure, but it's very dangerous. So I wanted this guy, he's a PhD and a DDS to
Is this guy nice? Hmm? Is he nice to you?
Yeah, I thought he was nice to me, and this all happened. The only thing that hurt in the whole damn procedure was, the suction thing coming. I get in my tongue
on the corner
a couple times. Yeah, that's happened. A couple big deal. And then the needle really didn't hurt either. I mean, needle, no, not a problem. It's just really the needle didn't hurt either. Not like my other dentists where. I mean, pain. This it was a half hour procedure. And my eyes closed. They didn't have music playing. They could have had music playing, but I was listening to what he was doing. I was trying to guess at what he was doing, where he was doing it, and actually, he was finished with these procedures when I thought he was doing them. He was that fast. Yeah. So within the half hour. You didn't believe me
when I told you in the beginning, I'm going to do everything so fast.
Yeah, you told me to keep my mouth shut for half hour and not
because you ask a lot of technical questions, and that's because of your background.
If I asked him any more questions, you're going to charge me $160 an hour. And actually, less than a half hour later, he had this old thing out. He had it treated. He had it packed with new bone material, and he explained it was irradiated, and it was safe, and then he had a hole in there for the new thing, and it got the new thing in. I didn't even know he was putting the new thing in. And it was in, and then he had the end of it on, the button, I think they call it, and then he even put a temporary tip on it, and he did this purposely to make it shorter than the other teeth, and made me move my teeth around when he was through to make sure it wouldn't touch, because he didn't want it to be screwed with.
Yeah.
So I was very impressed.
Exactly.
I'm a scientist myself.
Yes,
really,
exactly.
And everything I do as a locksmith has to be right on, or it's just no good. Yeah. And this fellow,
he's more than a locksmith, and he has a scientific background. And the thing I liked about actually treating you is that, number one, I like patients who are skeptical in the beginning, because at the end, they have more faith in me.
Very skeptical,
You ask tons of questions, and I love answering questions because I teach periodontics at UCLA. So I like patients who ask a lot of questions.
I was in research in physiology and biophysics, University of Washington Med School, orthopedic surgery, and endocrinology. And so I put this guy through the ringer first because,
I thought I'm taking an exam with my professor. You asked me so many questions.
Well, it showed that he did, in fact, know what he was doing, and I couldn't catch him on anything. Really.
No.
And so I was.
But
really
it's a
impressed.
pleasure to have you at the office, and I hope in the next 24 years I'm going to see you every 6 months for a checkup. And that's what makes me happy, to create a long-term relationship with my patients. Thank you so much.
It is very good.
Thank
It
you
is
so
very
much.
good.
Appreciate it. Very kind.